My name is Jeff Tyner, and my specialty is thoracic oncology surgery and adult cardiac surgery. With regard to thoracic oncology, the predominant procedure we do involves with lung surgery, lung cancer surgery, but we're also involved in any malignancy that involves the chest, or a benign procedure as well. I think what makes my practice of thoracic oncology special is my association with the other specialists that are involved in thoracic oncology and the technical aspects of what we do. There's radiation oncology, there's pathology, there are pulmonary physicians, there are radiologists, and myself representing surgical oncology. So when a patient sees one of us, they basically see all of us. But I think what is equally important is that we now have a navigator to help facilitate this response, somebody who is sort of a touchstone for the patient so that they help the patient get through this continuum of care to minimize the time between diagnosis and therapy. When a patient gets a diagnosis of cancer, they tend to glaze over, and sort of understandably, it's a big emotional issue. And having somebody who can help focus them, like our navigator, to help them get through this, get to see the specialists they need to do, not only, I think, provides an emotional support for the patient, but also expedites their care. With regard to the surgical aspects of surgery, I think the big things that have happened really are threefold. One is that we now do our surgery in a minimally invasive fashion, so it has a much less impact on the patient with regard to moving forward in recovery. We've also found that we can do a more limited resection of the lung for lung tumors. So long term, patients are losing less lung, so it has more of a minor impact on them. The Scripps and MD Anderson partnership is a very special one because it allows patients a couple of things. One is it allows them access to the technical care and expertise that Scripps has been delivering for decades. But the other part is it allows them access to input from the world's leader in cancer care. For example, if there's clinical trials that may benefit them in some special way, they have access to that. So they know they're getting cutting-edge technology along with the local care that they've always come to expect from Scripps. For example, we have patients that have resectable lung cancer, and now they have access to a clinical trial that's involving immunotherapy. So we're actually using the patient's own immune system to fight their lung cancer in addition to taking it out surgically. So these are very exciting times for lung cancer patients, and I think this combined approach, so they're not just seeing me, they're not just seeing an oncologist, they're basically seeing everybody at once, really reassures them that they're getting the care that they need and getting multiple inputs, and they have this navigator to help them get through the system in an efficient fashion. I think our multidisciplinary approach to thoracic oncology provides the best opportunity for patients not just to get the information they need to satisfy their own concerns or their family's concerns about their oncology, but also to get different opinions with regard to how to approach this, but equally how to recover afterwards and how to regain their lifestyle after surgery. And I think Scripps, by this spectrum of care that we deliver, both pre-op with diagnostic care to facilitate the time frame from diagnosis to therapy, helps minimize the impact of this malignancy on them so they can, again, get back to their life and the things that they enjoy doing. When patients come for their first visit, it usually is the most important visit in my mind. It allows us to meet with them and talk with them and come to understand what their expectations and what their concerns are. And it allows us to really understand and have the patients know that we see them not just as somebody with a malignancy, but somebody with a life outside of the hospital. I think probably one of the most satisfying parts of my job is when I see patients back post-operatively in follow-up. Their incisions have healed, their x-ray looks good, and they're looking forward. And they're coming with their partner or their spouse, and they both are happy with their recovery. They're beginning to start doing their hiking again. They're taking walks on the beach, and they're returning to activity, and they can see a future out there past this malignancy. I call everybody the night before surgery at home just to touch base with them, let them know we're thinking about them, that we're prepared, we have everything we need for surgery, and we encourage them to call us at any time as well.